Hello again. The Western Cape is noticing a slowing in COVID-19 mortality and admissions to hospitals. While the peak is still predicted at the end of July, current data suggests it won't be as high as predicted over the past week. There have been fewer admissions to hospitals in both the public and private sector. Mortality rates also are not as high in this period as predicted. Field hospitals are helping to ease the pressure off facilities. We speak now to my colleague, Lindsay Daintlinger. So, Lindsay, just talk us through events of the past week in the province.
Good afternoon, Judy. Well, we know that the province holds a weekly press conference to inform residents here of what's happening in the province. Last week, that DigiCon was cancelled for the first time because, as we know, the Premier himself has tested positive for COVID-19, and he usually participates in these press conferences. But what we've learned today, very cautiously optimistic, that the figures looking a little bit better over the last 10 days than they have in recent weeks in the province. And as you've pointed out there, fewer admissions, average admissions to hospital for COVID-19 from what we've seen around 1,900 round about now to 1,600 or so per week. And also the mortality rates coming down somewhat and currently standing at around less than 3% of the case rate. So what the provincial health authorities are saying today is that the data that they've been working on, the models that they've been working on, the predictions that have been made for this time in the pandemic, slightly off that and looking slightly better, but not to say they say that it could not, doesn't necessarily mean that we won't see peaks again in later months. But for now, the data certainly suggests that looking better than what earlier predictions were for this time in the pandemic in the province.
Provincial health authorities, they're also looking at the role diabetes has to play in COVID-19 infections. What have they found?
So over 2,500 people have died in this province already from COVID-19. That's higher than in any other province in the country. And diabetes appears to be playing a very large role in those people who have died from COVID-19. As I pointed out, the Premier himself, a diabetic, and himself infected with the virus right now. But the professionals who have been looking through the data, combing through data in this province and making comparisons with studies on diabetes and its links to COVID elsewhere in the world, what they found so far seems to suggest that while a diabetic might not be at greater risk of contracting COVID-19, it is certainly having a role to play in the mortality. And so somebody with diabetes more likely to die from COVID-19 rather than be more likely to contract COVID-19. But what the provincial head of health here, Dr. Keith Klutti, is saying today is that what they're really trying to do is to get diabetics to be tested sooner. As we know, the criteria for testing was revised in the province to give preference to those with comorbidities, those over 55, health workers. And so what they're seeing is that those with diabetes presenting themselves rather late to hospitals and making it a little bit more difficult to intervene in treating the virus. So that's really what the province wants to focus on right now, is to get diabetics who think that they might have contracted COVID-19 to present themselves sooner for testing.
You mentioned Premier Alan Winde, who's contracted the virus. Any update on his condition?
We saw him very briefly, Dudu, at the start of the DigiCon this afternoon, making some opening remarks. He looked fairly okay, probably not as we are used to seeing him, and he sounded a little bit like he has a stuffy nose, like he has a cold, but he's resting at home, and he said he wanted to join this week's DigiCon, at least to make the opening remarks, and particularly, as I pointed out, because he is a diabetic, and this week the focus really in the province on how to treat diabetics who also contract COVID-19. But he seems to be fairly okay, healthy enough at least to join the DigiCon from home.
Lindsay Daintlinger, let's leave it there. Thank you.